name is Amanda Mapp. I'm a licensed physical therapist here at Riverside Shore Memorial Hospital at our outpatient clinic. Today, I want to talk to you about how to keep falls out of your autumn. I'm going to go over who may be at risk for falls, things that may cause you to become a fall risk, how to prevent them, and some exercises on how to improve your balance and your strength so you don't become a fall risk. Per CDC, 1 out of 4 people over the age of 65 has a fall each year. About every 15 seconds, a person may be seen in the emergency room due to a fall. 95% of those might end up with hip fractures, and one of the most common causes to a brain injury is from a fall. A person who has a fall doubles their chances of having another fall that year. And when someone does fall, they may experience the fear of falling again. This can cause it to become a snowball effect, because if you develop a fear of falling, you may develop a fear of going out into the public again, getting depressed, not eating, which then can cause you to have poor health, which winds you up in the hospital or a nursing home, or even possibly death. So we don't want that to happen. Some things that you may see that can cause you to become a fall risk is, just changes in life. As we get older, our balance isn't going to be as great as it once was when we were younger. And that's why we love to say, if you don't use it, you lose it. If you don't practice it, then it might not be there. So practicing your balance is a great tool to always do and to always have in the back of your mind. Things that you may also see or experience that can cause you to become a fall risk is poor vision, poor hearing. Those are part of your senses, your 5 senses. So if you lose one of them, that can make you become off balance. Medication, adding too much medications together or not taking the proper medication can cause you to have high blood pressure, low blood pressure. Changing in the sugar can cause you to become unstable, which that of course will make you a fall risk. Also, not using the right assistive device that you may need, having poor gait abnormalities. What I mean by that is maybe you're not clearing your feet when you walk, your toes getting caught. You might have had a recent stroke, have foot drop, have neuropathy where you can't feel the bottom of your feet when you're walking. All of these can play a factor in your balance and your footwork, which messes up your gait, and then that can make you become a fall risk. Pride is huge. You not wanting to use assistive device, you not wanting to talk to your doctor if you've noticed that you've become off balance or you've had recent falls. All of those can lead to becoming a fall risk by itself. Other things is depression, anxiety, the fear of falling, balance and instability. Things that you may see in your home or around the environment is obstacles that may come around, such as animals, dogs, children's toys, especially if you have grandchildren in your home that may be home for some breaks or out of school. And you're babysitting them and you're not familiar with their things being around your home. Also cords that may be in your house that aren't in the proper areas or that are in a cluster. Your shoes, if you're wearing slippers because it's getting cold outside and you want to keep your feet warm and they don't have good grips on the bottom of them. Speaking of grips, we all like to have those nice little mats in our showers and in our tubs, but if they can cause you to become slippery, especially when using soap and water, then they are fall risk. So make sure you have the proper gripping in the showers. If you don't have railings in your showers or going up your stairways, if you have uneven surfaces, if you're noticing that your rugs have a little step up to it or a little parts that stick out above the floor, those are also risks. They look nice, but they can cause you to get your foot caught onto them and tripping over them. They can become slippery, slip out underneath of you. New environment, going and visiting family members, not really knowing where things are at in their home, or if they have animals and you're not used to that. And lighting. The lights in your homes, the darker it is in your rooms, the worse it can be. So you want to make sure that that you're familiar with your surroundings. out going shopping in the store, floors can become wet, there can be curbs. And here on the shore we have beautiful trees, and with fall coming and things falling from our trees, we have cherry bombs, we have pecans. These are all the things in our yards that we are familiar with, but we might not always see, and then that can make us become unstable as well. So the things that can help you prevent from being a fall risk is know your surroundings, know that it is becoming fall time, and the dirt's becoming a little bit harder, and as the ground gets colder and ruts are forming, those lovely molds are out there, and if you're walking the grass, be familiar with that it's not a even surface. We consider grass uneven, so just be mindful of that with your feet. Be mindful of the cherry bombs if you have pecan trees or anything with hard seeds that can fall from the tree that make your foot not even when walking on them. Gravel is another thing. Curbs, make sure you always know where curbs are. Make sure that your stairwell has good sturdy rails and that you're using them if it's needed. It does not mean that you are weak. It does not mean that it defines your age if you have to use a railing when you're going up or when you're ascending or descending stairs. Make sure you're using an assistive device, especially if your doctor is recommending one. If you're noticing your balance isn't stable, talk to them. Maybe they can come up with a good assistive device that's appropriate for you personally and stability wise. Maybe they can send you to us here to help improve your strength. Make sure you have proper footwear in your home, even if you have carpet. Make sure if you do have rugs that they are even with the floor and they're not creating any humps. Make sure that your animals, you always know where they're at and they can't easily just run over your feet and cause you to step and lose footage. Make sure that your bathrooms and the entire bathroom is safe for you. You have railings by the commode if needed. You have a sturdy sink. Your shower has bars in them if needed. And make sure you talk to your doctors about your medications, especially if you're noticing visual differences or instability when you're on them. Talk to your doctor. Good communication, good relationship is really the key with your primary care physician and you, into helping keeping you safe and helping prevent balance or instability problems and gait abnormalities. And just know that you know yourself and you know when something isn't right, and that there are materials out there that can help, such as physical therapy, hiding the cords off to a side, getting nice warm comfy slippers with a good footwork. Research this type of stuff. Research your medication. Always know what type of medication you're talking about or you're taking, and the side effects that may come with them. So say that you do have a fall and that you are home alone. If you know that you are a risk for falls, or that you have poor balance and you're living alone, or you are home alone a lot, make sure you always have a device that can reach out to somebody, such as a cell phone or the life alert that people wear around their neck. Anything that can get assistance to help you immediately when you fall. But if you are home alone and you do fall, the first thing I want you to do is breathe. You cannot help yourself if you're in a panic. You must take a deep breath and say, okay, I'm on the ground. Let me assess myself. Check yourself. Am I moving my feet okay? Can I wiggle my toes? Can I move my arm? Did I hit my head? Am I bleeding anywhere? Does anything feel broken? If no to these, and you feel that it's safe to get up, I want you to find the nearest stable surface, such as a kitchen table chair, a couch, a love chair, anything that is stable and sturdy. Not your walker, not a wheelchair that can't properly be locked, and definitely not a cane. Those are all devices that are not stable when you need something to help you up. If a couch is kind of far across the room, I want you to get on your hands and knees if you're able to and crawl there. You're going to put one hand on the surface and you're going to use the other hand, which is your good hand, your strongest hand, to help push you up and sit you down. Then from there, I want you to take a breath and think, okay, where can I look to call somebody? Do I need to call somebody? Do I need to call 911? Am I okay? Did I hit my head? Regardless, you should call your primary care physician just to let them know that you did have a fall and make sure it's not due to any type of medication issues, health issues. And so you have on a record of that if your falls are increasing or if that was just a fluke. Find out what may have caused you to fall, and if it was something that was a cord, a rug, you do remove that type of challenge and reassess your room and how to prevent it from happening again. Then that's where we can come in. If you do feel that you are having balance or falls or not so stable on your feet, you can call us here at Physical Therapy for our number 757-302-2700, where our lovely ladies will help assist in making an appointment for you. And you would see our physical therapist, and then you will see a physical therapist assistant. We love to work one-on-one with our patients. We don't have techs here, and normally in most cases you have one therapist and one therapist assistant, and you guys become very familiar with each other, with your case, and how and where you want to go in your physical therapy treatment. It's very nice to have that one-on-one relationship, so you can see your goals and see how you're progressing, or if you're declining, or what works best for you. Too many faces can get overwhelming, so just keeping that one-on-one with one therapist and one physical therapist assistant is what we feel works best here in our clinic. So some exercises you may see us do is we love to do some sit to stands, where we practice on getting up from a chair and sitting down. My favorite thing I like to say is ladies don't flop, so I don't like to see this. I don't like the uncontrolled sitting. I want you to use your legs to be able to go up and down. You can see us doing some heel raises. We like to do some standing leg raises to the side, some marching. But the one thing you will always see is us standing beside our patients for safety, and we use like our bar gate. We have parallel bars, and so we like to use them to hold on, or our sink, because these are things that patients might have in their home. So what we do in our clinic, we want to be able to do in the home for them as well. So I always tell my patients, practice your balance when you're brushing your teeth. You're by a sink, and we do it, or you should be doing it, at least 2 to 3 times a day. And I do it myself in my home. I like to hold my foot up and brush my teeth, and I'm working on my balance, I'm working on stability, and I'm working on that quad strength on the other leg. I'm getting everything done. So if you need any help preventing your falls in your autumn this season, reach out to us, because we care for you as we care for the ones that we love. And we want our patients to leave here and keep moving and keep going out in the community. And here at Riverside Shore Memorial Hospital, at our outpatient clinic, we got you. We are going to help stop the falls in your home, and we're going to help bring back to just leaves falling from the trees and not us. So I hope you have a great day, and reach out to us if you have any questions. Again, if you would like to visit us, you can call your primary physician, set up a referral, and they will help get you started in the journey here with us at our outpatient clinic. I hope you have a great fall season and not an actual fall. Thank you.